and the general population, the target group, unemployment and underemployment, through the work of the employment service officers. The work of social services engages with the community via the in-community and the home engagement sessions carried out by the social workers. The activities of the CDFHA include various empowerment, collaborations with community partners, and community outreach programs, while the CPS continues to work with community organizations to provide health-related information sessions where implemented. Some have concluded in the interim. 2 are ongoing, while 1 is about to start in November. These initiatives are designed to enhance community engagement. Additionally, the ministry also continues to engage the community with aspects related to disaster management, response, and preparedness. Question 19. MP states, I submitted a draft law and draft LBHAM for work permits based on the presentation with the NESC at the time. Did the minister receive the LBHAM, and is it the intention of the minister to follow through on this LBHAM? Answer, the ministry would like to thank the MP for this draft provided. The ministry is aware that there is a need to update the LVO and LBHAM that regulates the employment of foreign workers, and that this must be done in a comprehensive manner that takes into consideration all key stakeholders. Therefore, the ideas brought forward in your drafts will be taken along as part of the complete package of reforms when this comprehensive legislative change is brought forward, taking into consideration resources and priorities. Some points brought forward in your draft were already being discussed in the ministry with the legal consultants, such as the increased fee for rapid permit processing. I have assigned the respective Department of Labor to review the proposed changes and to discuss these with the executive agency, Labor Affairs, and the Department of Labor is expected to draft a nota on the proposed laws on what is attainable and the time frames tied thereto. Moving on to MP La Cruz. How many requests of doctors are pending? Do we have a list of how many doctors are awaiting to be able to come to St. Maarten and treat our patients here? There are currently no pending applications for employment permits for doctors, nor do we currently have a pending list of establishment permits. Question 2. How much has it saved SZV bringing the doctors here instead of sending the patients away? Based on the information received from both SZV and St. Maarten Medical Center, there is a decrease in the amount of medical referrals. However, due to the complexity of the cases being referred abroad, there is an increased cost incurred amongst these patients. Question number 3. The homeless shelter, Dr. J. How far are we with relocating or helping those senior citizens? And there was mention of a particular amputee that is homeless. Have we found a solution for him as he is in dire need of it? The 5 elderly individuals remaining in the T shelter at the time of the downsizing and closure have been relocated to the White and Yellow Cross, have been relocated to the White and Yellow Cross Foundation, and others to the Reduced Guided Living Program tailored specifically for these elderly. How does the ministry plan to manage the reduction of the legal and expert advice budget, especially for departments heavily reliant on these services? Legal and expert advice has been taken along in the technical support projects of the TEWEO, country packages, the VNGE, and international organizations such as PAHO and CARFA. Question 5, will the reduced subsidies impact social programs or community support initiatives? The budget for subsidies was adjusted in accordance to the formal request for funding support as submitted in line with the subsidy ordinance, meaning subsidy recipients are asked to submit for subsidy before March 1st of the year before the subsidy year. So once they have done that, we've taken that into account, and then we've put that in, it's in the budget. Question 6, given the reductions in the social benefits and emergency provisions, what measures are in place to ensure that the vulnerable population continues to receive adequate support? It is expected that the remaining budget for the coming 2.5 months will be enough to cover the cost of social benefits and emergency provisions. Question 7, are there alternative funding sources or partnerships being considered to address these cuts, particularly the department like public health and social development? Yes. Many of the projects of the departments of public health and social development have been linked directly to the technical support projects of the Terrio country packages, the VNGE, and international organizations such as PAHO and CARFA. Question from MP Myers. How long have you been the Minister of VSA? I have been the Minister of VSA since May 3rd, 2024, 5 months and I think 13 days, 5 months. Question number 2, page 98, can you explain the drastic drop of the 1,124,750 to a reduction of 412,000. Which projects were these, and when did they end? Did they yield positive results? This pertains to a difference between the budgeted amount of 2023 to 2024. The projects are the public health law, mental health legislation, national health insurance, and legislation on implementing a registrar for healthcare professionals. These projects are now linked directly within the technical support programs of Terrio and VNGE. On page 96, the Dienstarbeitszaken, hiring of employees for the Department of Licenses through the outsourcing agency. Which outsourcing agency is this? The St. Maarten Placement Network was previously used. Why 115,000 for this process? While we have unemployment on the island, couldn't this be placed in the newspaper? Wouldn't that have been cheaper for the department? This was a provision put in place following Hurricanes Irma and Maria, as well as COVID-19, when there was urgent and immediate need to have the division boosted with the human resources. Currently, these persons who are all local have been placed within the organization and are no longer under the outsourcing agency. Question 4, on page 91, there is 125,000 allocated. Who is this medical advisor? Is it one or more that you are talking about? What is his advice and findings, actually her advice and findings to St. Maarten's situation, and do you have any reports? Have you taken any measures according to those advices that you received? Are these funds being accounted for? The medical advisor mentioned here pertains to a medical doctor who provides the medical support for the ambulance services and the oversight for all the medical-related responsibilities and procedures. The advisor bears the ultimate responsibility of the medical actions carried out by the ambulance nursing staff and therefore addresses complaints regarding the ambulance services and evaluates and provides training for staff continuously. The overall advice of the medical advisor is discussed with department heads and taken up in the enhancement of the processes and procedures of the services provided by the ambulance. The MP stated in question 5, as a local mortician, I am aware that government contract certain medical practitioners to be the doctor on call for the overridings actor. The MP is not sure if it is still the case, but they would be paid through the government. Families are complaining that they are being charged by the practitioner for this. Has the funding for the practitioners been discontinued? It is unfair for government to be paying on one end and the family paying on the other end for the actors as well. There is no established tariff for this service. However, the funds government has budgeted pertain to an amount allocated as on-call services for physicians to be available in the event this service is needed. The family still has to pay for the actor itself in the event that the service was used. Excuse me. Question 6, bakeregistratie. It allows primarily for recruitment for medical practitioners out of the Netherlands. Are there any considerations that recruitment for medical practitioners that can come from within the region to St. Maarten? The recently published policy establishment of healthcare services includes the procedures, assessment of competencies of medical professionals who are not registered in the BIC to establish themselves on the island. So, yes. Question from MP Westcott. SZV, the numbers will be provided to Parliament. Does those include a breakdown? This has been emailed to the Secretary General of Parliament. Please confirm that this is the breakdown that was requested. I don't know. And then there's only one more question. Cuts will have an effect on the social registry. What effect exactly will this budget amendment and the cuts under your ministry have on this particular project? We will not be able to continue with the hiring of the additional staffing to support the social registry, such as the additional household managers, household coordinators. We are still able to continue with data collection, though, on a more reduced basis. After the execution of the pilot, emphasis will be placed on the communication plan and innovation for data sharing or application updates. There concludes my answers to the questions. Thank you.
Minister Janssen of VSA, thank you for the answers provided. Of course, now this is the opportunity for the members of Parliament to react and or ask anything additionally. And I see that MP Roseberg has requested the floor. MP Roseberg.